like preventing HIV from being transmitted. So the key message is HIV equals AIDS equals death, wear a condom, right? So that's kind of the big marketing message, and that's around prevention. But then you come to South Africa, where you've got 20% of the population who has HIV, and if you believe HIV equals AIDS equals death, then why bother to find out you have the disease? Why bother to treat it? Why bother to manage it? Because you're on this road trip to death. You have a terminal illness, and if you have a terminal illness, or you believe you have a terminal illness, there's certain things that you do. You step back from the support group. You try and be as low impact on your support group as possible. You don't take on long-term projects. You don't get educated. That's a long-term project. You don't start a business. You don't buy a house. You don't plan for a long future. And if your support group has money to invest, then you rather actually have them invest in someone you think has a longer future than you. And when you get declined for life insurance, if anybody in this room gets declined for life insurance, understand the life company is actually saying, we're for profit and we don't think you're going to live long enough for us to make a profit off of you, so we're going to turn you down. And that's quite a terrifying message. If you do get declined, go see your doctor almost immediately. And so what happened is when we looked at this space, we said surely we can offer life insurance to people living with HIV. And when we started going into detail, when we started looking at why life companies weren't offering cover to people living with HIV, we realized that the problem is that there are two groups of people living with HIV. There's the group of people who are doing the right thing, and they're going to live a long time. There's the group of people who are doing the wrong thing, and they're actually not going to do very well at all. And actually nobody sits at the average. So if you're a life insurance company, the way life insurance companies work is that the past is a predictor of future behavior. So how you used to behave does predict how you're going to behave. So if you smoke, they assume you're going to keep smoking, and that's how you get priced. But in this world, nobody sat at the average. So if you actually create a product for people living with HIV, you create the product, people who are doing the right thing shouldn't take it because it's too expensive for them. People who are doing the wrong thing should take it because it's priced incorrectly for them. And then the pricing gets more expensive because you've got what's called anti-selection in life insurance. So we could see that there was a problem for the life companies. It's a big market segment in South Africa, 20% of the market that no one was particularly interested in serving. But they had a material problem because the way life insurance companies work is that you look at the past as a predictor of the future, and they're not great markers as to how people are going to behave. And anyway, at the time, in 2004, when we were talking about this, there weren't a lot of predictors, there wasn't a lot of information about how people were going to behave. And the group of people who were doing the right thing was pretty small. So we looked at this and we said, actually, we could maybe do something different here. We can't tell who's going to behave correctly, but what if we don't care? What if we take people who come into our environment and help them behave correctly? So we take them from whatever group they are, whether they were going to in the past behave incorrectly or correctly, and we help them manage their health. Seemed quite simple at the time, but then to do it in a low-cost fashion, we had to link into the IT infrastructure of the healthcare industry in South Africa. It took us a few years to deliver and get access to all that data so that we could actually tell how our clients were behaving and direct them to do the right thing. And then we launched. We launched a life insurance business. We were reinsured. We got a reinsurer to come on board. The reinsurance company is a small business known as Gen Re, part of Berkshire Hathaway, owned by a very poor gentleman, Warren Buffett. And they stand behind our product set and on the back of our admin infrastructure. So we provide kind of standard life insurance products in a pretty standard way. It's largely a direct offering. And clients come in our doors and they cede the policies to banks for home loans and business loans, and they act like anybody else. And that's quite a dramatic thing. For our clients, aren't used to being treated just like clients. They're used to being referred to as patients or HIV sufferers, and treated in a different way. Our clients actually just want to be clients. We market to them exactly the same way that anybody else does. We advertise on TV. We're the irritating direct marketer that sends you text messages automatic voice messages get spoken to by a computer. And we use all the kind of media strategies anybody else does, and we treat our clients like clients. We thank them for choosing us as their life insurance provider. And in fact, what's happened along the way is it's quite a shift in attitude, a change in the way the disease is perceived. Because when we talk to clients understand we are a for-profit business. Okay, so they understand that for us to make a profit, they have to live a long time. Okay, if what we tell them to do doesn't take care of their health, doesn't result in them living a long time, then we're actually a for-loss company, okay, which is not what we are. And they understand the economic incentives. People get it really quickly. They understand almost immediately why what we asking them to do is so important to us, and hence important to them. So we get a much better response than the healthcare industry in getting people to actually adhere to proper therapy. So 98% of our clients adhere to proper therapy, and we deliver it in a much lower cost way than pretty much anybody else in the market as far as we can see, because we've linked in an electronic way into the systems of the healthcare industry, and we can drive behavior in a very low cost way. So we can see a dramatic change in our clients' health, and we see that almost immediately when they come on board with us, and we think that's a change of attitude. But otherwise, our clients are living healthy lives. We interact regularly. We talk to our clients an average of once a month. So if anybody has a life insurance policy, you've probably only spoken to your life company if you miss a premium. Other than that, they're not generally in regular communication with you. So we have to build admin infrastructure that actually can deliver this kind of interaction at a low cost, because otherwise you can't actually do it. So we're talking to our clients an average of once a month. We send them text messages, emails, letters, faxes, depending on how they choose to be communicated with, and we keeping them healthy. We're directing them into the primary healthcare sector. We're noticing when their drugs aren't working. We can see if they have or haven't gone for tests. We're tracking them, we're monitoring them, and then we're using largely high school educated people to interact with them. So that means that we've got a whole lot of the logic built into the systems that we've had to build, and ensure that we maintain kind of significant levels of training for our staff, because the education levels certainly in South Africa are not superb. So we're keeping our clients healthy.